Doctor, you were talking about oxygenation? Yes, more particularly hyperbaric oxygenation or hyperbaroxia. And doctor, that is a clinical use, is it? Yes, it is the clinical use of elevated atmospheric pressure. What is that produced by? It is produced in a hyperbaric chamber. Its principal effects are increased oxygenation and oxygen tension. Hyperbaroxia is thought to be of value in cardiac surgery and the treatment of cardiogenic shock due to acute myocardial infarction. Doctor, what is induced hypothermia? Induced hypothermia is an artificial reduction of the body temperature in an effort to lower the metabolic requirements of the patient. He is then better able to tolerate the interruption of cardiac inflow. And doctor, the medical electronics is what? Medical electronics is the use of electronics in medical areas. Electronics refers to the action of charged electrical particles in any medium, solid, liquid, or gas. Doctor, what is normothermia? Normothermia is an environmental temperature that maintains body temperature and metabolic requirements at normal levels. Is it, doctor, in current cardiovascular surgery, normothermia? Well, it is usually referred to as induced hypothermia. And what is an oscillation? An oscillation is a movement to and fro. And an oscillometer? An oscillometer is an instrument for measuring any kind of oscillations, for example, those related to blood pressure. And oximetry? Oximetry is the measuring of the amount of oxygen in a series of blood samples, either chemically or by reading cuvette oximeters of the samples obtained through a catheter from each heart chamber or vessel. Doctor, what is perfusion in intracardiac surgery? Perfusion is the method of providing oxygenated blood in the body by a heart-lung machine while interrupting the circulation through the heart. And what is precordial shock, doctor? It is an electrical treatment of arrhythmia. Is that through an elective procedure? Well, an elective procedure, yes, for converting certain tachyarrhythmias to normal rhythm. It is known as cardioversion. And cardioversion is also an emergency procedure for controlling ventricular fibrillation, doctor? It is usually referred to as defibrillation. And doctor, what is sphygmomanometer? A sphygmomanometer is an instrument measuring blood pressure. And a stethoscope is an instrument for listening to sounds within the body. What is a synchronized direct current counter shock? Well, that is an electric shock producing cardioversion by the use of a synchronized capacitor. The synchronizer is contraindicated in ventricular fibrillation. And doctor, a transducer is medical, is it? Yes, the medical use is a transforming device which transmits energy from a patient to a monitoring machine. And what is a treadmill exercise tolerance? The treadmill exercise tolerance is a stress test for evaluating the ability of the coronary circulation to meet the metabolic demands of an increasing exercise level. The patient is subjected to graded exercise on the treadmill or bicycle ergometer until his electrocardiogram shows ischemic changes. Doctor, is there a two-step exercise test? Yes, the Masters test, which is an exercise test of coronary reserve. Within 1.5 minutes, the patient goes up and down 15 to 25 times, 2 steps, each 9 inches high. A post-exercise electrocardiogram is taken at once. If it is negative, a 3-minute double two-step test is performed. As soon as the patient experiences pain, the exercise is discontinued. Doctor, what is a Valsalva maneuver? It is the effective treatment for paroxysmal atrial tachycardia and similar disorder. The patient is instructed to inhale deeply, hold his breath, and then strain down forcefully while slowly counting for 10 seconds. The Valsalva maneuver is also used as a test for cardiac reserve. We had that in this last thing. The guy said, I gave him the Valsalva maneuver, and so it sounded familiar, but not that familiar that I didn't have to go to the dictionary.